In many cases, there's not somebody telling her, you should really fill out this application right now or you'll become uninsured. And if she misses one of those applications, she's uninsured. And we all know how long it can take to get a Medicaid determination right now. So it's really important that you don't miss or even dilly-dally on filling out these applications. The marketplace will change all of that. In addition to having this single streamlined application, the marketplace, which will be a website, I should have mentioned that, it'll be a virtual marketplace. The marketplace will be talking to federal and state government systems. So we should get, and I say should because we have some kinks to work out, but we should get an instant determination for Medicaid and private health insurance. I think in reality, when the market first opens, it could be 2 to 3 days for Medicaid. Ideally, once the system is really smoothed out, you will be able to go online, pick your health insurance, fill out your application, and print off your medical card right away. Kind of like you do with your auto insurance now. So that's a huge change, right? And we haven't even gotten to the part where you shop for health insurance. So after you fill out the single streamlined application, you will find out right away what tax credits and subsidies you are eligible for. So you will know your federal support before you're ever looking at health insurance plans. Then you will find out if you qualify for one of those public health insurance plans. So we're thinking primarily Medicaid and the Children's Health Insurance Program. Medicare is not going to be sold on the marketplaces because they've already got a really good system running. If you don't qualify for public health insurance, or you fall into that little in between, the overlap of 100 to 138% of the federal poverty level, you will be able to go on and look for private health insurance plans. And this is where it is another really big change. The idea of the marketplace is that when we're shopping for private health insurance plans especially, the marketplace will give us the information that we need, the tools that we need, and the ability to organize all of that information in a way that we can actually make a real decision about health insurance. Which, I'll just let that sink in for a second, because most people, even the best educated people, really struggle to make real decisions on health insurance, because that's how the health insurance companies have designed the system. So the way that it's going to do this is in 2014, there will be a standard description of benefits. Every plan will have 6 8.5 by 11 pages. Single-spaced, double-sided, 12-point font. They're really specific on this. That will replace the booklets that we get right now. In those 6 pages, everything will be described in plain language. So we're getting rid of all of that insurance jargon. Where we absolutely can't walk away from jargon, words like co-payment, those will be defined in these 6 pages. Within these 6 pages, the insurance companies will be required to talk about themselves on the same standard points. The idea being that you can have this booklet in front of you for every single insurance plan available to you. Flip to, say, page 3, and go to line 5 and find out what's important to you. Maybe that's your emergency room co-payment, right? Really, really easy to make a decision, and that's just on paper. With the marketplace being online, it can be a lot more dynamic. So the marketplace will actually be able to organize plans for you based on the standard points that matter to you. So one of the things you'll be able to do back at that application, once you've told the marketplace everything the marketplace and the insurance and the government needs to know about you, you will tell the marketplace what you want it to know about you. Maybe you have a doctor that you really like to see. You'll tell the marketplace, make sure Dr. Faulkner is in network. Or maybe you have a benefit that you really like to access that goes above and beyond what are called the essential health benefits or the standard coverage every plan will have to offer. That could be something like chiropractic care. You'll tell the marketplace, only show me plans that cover chiropractic care. Then when you go in to look at plans, you'll be able to organize them even more dynamically. So we don't know exactly how that's going to play out. The website's not done yet. We haven't really seen the framework. We know that's the intent. What this will look like, or the way I want you to think about it, is like an Expedia or another budget travel website, right? You go to Expedia, you tell Expedia who you are, where you're flying from, where you're flying to, and what time you want to leave, right? This is where you start to get to your preferences, what time you would like to arrive, maybe. You tell it you really hate layovers, so you don't want any layovers, or maybe you only want one. You can tell it, I work for a nonprofit, I'm a social worker, so I'm definitely going to fly first class. You can tell the market, you can tell Expedia all of these things, and then the next page, right? The next page, it says, Southwest Airlines leaves this time, arrives that time. Here's your one layover, and this is where it is, and how long you'll be laid over for. Here's the same information for United, for Delta, for Alaska Airways, right? For all of these different airlines or air carriers. That's what the marketplace is going to do for your health insurance. One of the other great things you can do on Expedia is you can sort, right? You could look at plans or look at airlines. Let's see what flight leaves earliest. Let's see what flight has the least layovers. You can organize by price, low to high or high to low, though I don't think anybody uses that option. That's what you'll be able to do with the marketplace. You'll be able to get, not a chart, because health insurance is way more complex than airline tickets. You'll be able to get some sort of side-by-side comparison of plans that you can organize based on the things that matter most to you. It's really transformative, it's really exciting, and it's really hard to think about, and I always wish that I had something I could show you at this point.
I'm not nearly as enthused about the marketplace. I'm concerned. The way the marketplace works now is that due to legislation back in the 30s, corporate entities and organizations get breaks. And as a result of that, good insurance and affordable insurance goes to the people that work. The people that don't work have to buy insurance, sometimes end up, even for a pretty high premium, they have like a $5,000 deductible, My concern is that our wonderful friends at Blue Cross Blue Shield and at United Healthcare and all those places will set their prices pretty close to the way they are, and it won't really be of much benefit to anyone.
Yeah, so the question or the kind of idea was that this all sounds fine, but we live in a corporate society, right? And the corporations hold a lot of power, and as a result, people who are powerless in society end up with really crappy health care, if anything at all. And that is an extremely valid point, and fortunately, the law does a lot to address that. So there are a lot of things that we didn't talk about around the way that the insurance company is run. So there are a lot of standards now in how they can charge. For example, there's something called the medical loss ratio that says an insurance company must use 80% of your premiums on your health care. And if they don't spend 80%, they have to send you a check for whatever they didn't use, right? So this is either assessed for individuals or groups. And we've seen some checks going out. The idea is that's going to start bringing some premiums down, especially when we talk about those really high cost plans that provide very little coverage. The other way we're getting to those plans where maybe you're paying hundreds of dollars every month and you have really low annual limits or lifetime limits is by eliminating annual and lifetime limits. So one of the examples I just love, because it's so frustrating, is a lot of fast food franchises advertise that they offer insurance to their employees. For example, Denny's offers free insurance to all of their employees. Free health insurance, everybody who works full-time. Denny's has an annual limit of something like $100. Other places say we'll offer you free health, or we'll offer you health insurance, you pay us $20 a month, and we'll let you go to the doctor once. So we know that there are a lot of these really bad plans out there. This law outlaws lifetime limits and annual limits. So lifetime limits are already gone, annual limits are being phased out. So beginning in 2014, annual limits will be gone. That means your health insurance provider cannot cap you at any point. Of course, that still leaves deductibles and co-payments and premiums, which are in part addressed by the tax credits and subsidies. The other way that we're addressing the quality of health insurance coverage is by enforcing something called the essential health benefits. So beginning in 2014, every plan sold inside and outside of the marketplace must be comprehensive. And it's really detailed. I could do a whole presentation on the essential health benefits, but basically the federal government defined 10 categories of coverage. Some of them more broad than others. So for example, preventive and wellness services, or mental and behavioral health care, or my favorite, hospitalization. And they laid out these categories and in many cases didn't define what that meant. They left it to the states. And the way the states did that was they selected an existing health insurance plan. So in Illinois, they actually selected a Blue Cross Blue Shield plan. So Blue Cross Blue Shield Blue Advantage. It's the largest small group plan. That plan as it exists today, everything that it covers, every way that it covers those things, will be the floor. No plan can be sold in Illinois unless it sells at least that coverage. So we're going to see a lot of people, especially low-income workers, having vastly improved coverage, and those annual limits are also really going to help a lot of low-income workers. So the marketplace itself is just the vehicle by which we're selling insurance, but the law has a lot of provisions. As I said, this is my very truncated presentation, but the law has a lot of provisions to actually improve the quality of coverage that we think will address a lot of those problems. Now, is this law perfect? No. Is it good? Absolutely. We think that when we're thinking about improving access to health insurance, improving access to care, improving health outcomes, especially for low income and communities of color, this law is really doing a lot of good work. Did you have a question?
Yeah, you said comprehensive. Does that include dental and vision?
Ah, you caught the catch. So this law for adults only addresses medical care. And that was partially because I think they just felt like they had to stop somewhere. I would have liked to say, no, you don't. But the law does require that every plan provide dental and vision for children, but not for adults. Which is a great next step, right? When we think about what are we going to do on January 2nd of 2014, that's definitely one of the things we're going to be talking about. So I just want to talk briefly on, oh yeah.
So the marketplace is just for private insurance?
No, the marketplace is for private and public. The only plan that likely won't be sold on the marketplace is Medicare.
So Medicaid is on it too?
Medicaid will be on the marketplace.
So ultimately, they're selling for private.
Yes, so we say that the marketplace has no wrong door. Anybody who goes on should be able to find coverage, and we think that the marketplace might even point you to Medicare if you end up qualifying, you just won't enroll through the marketplace. I forgot to mention one of the other cool things that's going to be in place to help improve the care for especially low-income populations is that the marketplace really, it levels the playing field a little bit, so it tempers those large corporations. And the way it does that is the law actually says the marketplace must include a non-profit, consumer-oriented and operated plan, or a co-op. So just today we had a webinar with Land of Lincoln Health Incorporated, which is the non-profit co-op in Illinois. So this will be a non-profit corporation who's providing health insurance. They say that they are confident they can compete with the major insurance providers. Co-ops are the only plans that are required to sell on the marketplace, so they must sell at least 2/3 of their plans on the marketplace. And as a nonprofit, they don't answer to shareholders. So any revenue they have left over at the end of the year must go back into the plan, either to reduce premiums or improve quality of care or networks. The other cool thing being a co-op is that every decision is a member decision. So it is a member-run organization, consumer-focused. The board of directors will be elected by the members or the policy holders. So it's another way that we have to kind of force competition, right? If everybody has to provide that same minimum coverage, and a nonprofit is able to do that at X, but Blue Cross Blue Shield is doing that at X times 5, the marketplace will allow you to see that and give you the information you as a consumer might need to say, well, heck, I'm going to go with this nonprofit. At least in theory, right? The devil's in the details. We'll see how it all plays out, but that's really the intention of the law, is to level the playing field in a lot of ways.
So currently, as it is now, people who need to apply for Medicaid, they go to a local office. But when this new system works, you can just go to the website and do the application?
Yes. So the question was, people who apply for Medicaid now have to go to a local office.
It takes
But
3 to 4 months.
right, it takes a very long time to go through that process. The marketplace is intended to make it where anybody applying for Medicaid will go online and they will have a much shorter determination period. Again, this is Illinois. I don't want to run around and say that I think everything's going to be perfect on day one. But the state has been taking a lot of steps over the last year or so. Part of this whole electronic eligibility verification thing was to prepare them for this process. The contract to Maximus, if you guys pay attention to this stuff, is all to prepare for this process. So yes, in 2014, folks can just go on the internet, fill out their applications all on their own. But that's an excellent segue into the last part of my presentation, which is the fact that I think most of you know the clients that you work with will not be able to go online and do this themselves. So the last section is outreach and education, and I should really include in here enrollment. So I offer this graph at the bottom of page 3 that says it's the impact on the uninsured. So this is based on uninsured data from 2010, so it's not the most accurate information. But based on that uninsured data, we've been able to make some inferences about how many people will qualify, or how many people will go down these different paths that I've talked about. So in Chicago alone, we've got 228,000 who are eligible for new Medicaid, or likely eligible. Those are the folks who can enroll in county care today, because, right, Chicago and Cook County are special. When we look at folks who fall into the subsidy or tax credit population, we've got another 235,000 people who will have access to these tax credits and subsidies in Chicago alone. And then we've got about 70,000, or just under 70,000 people who have incomes above 400% of the federal poverty level, but for some reason are uninsured. Many of these folks have pre-existing conditions, right, and they're being denied coverage. That becomes illegal in 2014. So those folks will be able to go onto the marketplace, shop around, use all of that new competitiveness and transparency and whatnot. They just won't get tax credits and subsidies. Then if you flip to page 4, that top chart is based on a recent poll done by the Kaiser Family Foundation, looking at the uninsured population and really the American population as a whole, and figuring out what do they know about the Affordable Care Act. And I'm sure you guys can all guess the answers without even looking at the chart, right? So the question was asked, do you feel you have enough information about the health reform law to understand how it will impact you personally or not? Total population, 57% of people said, I do not have enough information. So that's already disconcerting, right? Half of the population in general doesn't know. Then you look at household income under $40,000 annually. You've got 68% of people who say they don't know. And then you look at the uninsured, and we've got 67% of people who don't know. Uninsured and household income, low household income like that, those are the target populations. Those are the people who stand to gain the most from this law. And they're really the people who need to know about it. So Kaiser Family, after they asked this question, they then educated these people on the provisions of the law, explained, well, this is, these are the 3 pathways to coverage, this is how you'll go about accessing the marketplace. So tell me now that you know how this law is going to impact you, are you comfortable going to the marketplace and filling out the application yourself? And the numbers looked a lot like this chart. Most people did not feel comfortable with that. People who were uninsured or had very low incomes really did not feel comfortable doing that. So then they asked, okay, if you don't feel comfortable, who do you want to help you? And the number 1 answer was my doctor. Healthcare providers have a lot of trust in our country, and it's not surprising. Number 2 was my mom, which is not a population we can do much for. And answer number 3 was my social service provider. That wasn't the phrase that they used when people said things like my case manager, or the guy at the food shelter I go to, or the person who runs the place that I'm staying right now, right? So that would be you guys. And so that's what we're doing now, is we're thinking about how can we connect people to coverage. So there are a few programs that are actually designed to provide the kind of in-person assistance that people are saying they want. And that's what really people have said. They said, I want somebody to sit down with me, shoulder to shoulder. This is the wrong fact sheet. I want somebody to sit down with me, shoulder to shoulder, and walk me through this whole process. I want them to help me fill out the application. I want them to help me pick my plans. I want them to be available whenever I have a question. And fortunately, the law has people to do that. So I'm passing around this fact sheet from Enroll America about the different consumer assistance programs. So when we think about who's going to do this, there are 3 distinct programs outlined by the law. And they are distinct, but they're really pretty much the same. So the first group are navigators. And I would bet that more people have heard of navigators now than a month ago, because the federal government released their funding proposal. Now that there's money on the line, a lot of people seem to know what navigators are, which is great. So there are navigators. Navigators are federally funded, and they are folks a lot like all these application agents. Navigators will be responsible for identifying vulnerable populations, going to those populations, finding people where they are, and telling them, you have affordable coverage available to you. And that's the message we're going to use. We're not going to say, what's your income? You might qualify for Medicaid, or you might qualify for tax credits. Because there are so many new options, we're just going to say to everybody, you have affordable coverage available. Let me help you figure out what that is. We're going to bring them back to the office, and we're going to facilitate enrollment. So actually sit down with folks and do exactly what they want. Walk them through the marketplace. Help them fill out the application. I didn't tell you before that streamlined application is 25 pages long. So it's not super streamlined, but it's a really good first try. It's a really good first try. So we're gonna walk them through the application. We're going to help them access those tax credits and subsidies if they're available. And then we're going to help people think about their health insurance options, right? So it's important to know navigators cannot be health insurance providers, and they cannot be people who are paid by health insurance providers for enrollment. If you are somebody who bills Medicaid for medical services or mental and behavioral health services, that's okay. Or bills health insurance, not Medicaid, sorry. If you're somebody who receives money from Blue Cross Blue Shield to enroll people into Blue Cross Blue Shield plans, you cannot be a navigator. Thinking a lot of brokers here, right? So navigators will walk you through, provide advice. They're not going to tell you, enroll in this plan, but they might say, well, what draws you to this plan versus this plan? Or what are your healthcare needs? Well, this plan really covers diabetes management much better than this plan. Navigators will also be available once